Hey everyone, this is Derek with OPTP. If you or some of your patients experience a lot of nagging pain in the scapula and even into the shoulder and neck, the ProPoint is a phenomenal tool to consider for using in various mobility and release techniques. It's an incredibly simple tool. I'm gonna show you 3 things that you can do in just a minute or two to hopefully really reduce inflammation, free up mobility in that area, and hopefully work towards recovery. So what we're gonna do is we're gonna take the ProPoint here and we're gonna position it on the floor. You can either have the suction cup on or off. I'm gonna take it off here. And what we're gonna do is we're gonna find the region in the back just to the side of the spine and getting into the base of the scapula. And we're gonna position the ProPoint right there. Now, as we lean back, some of us might already feel a very deep release taking place right here. And if you do, we would just breathe into it and relax. Now, after we felt or feel that muscle tissue loosen up slightly, we're going to begin to engage in some mobility techniques. So I'm gonna take the hand here, bring it out in front of the body, and then I'm gonna let it drop out to the side. Now we start to engage in some movement of that scapula, making sure we're breathing. After we've done about 5 repetitions going out to the side, we can bring it back, getting even more motion in the scapula here. Breathing. The last thing that we're gonna do is we're gonna drop the hand down to the side of the body here, and I'm gonna take my same side leg, cross it over, open up the hips, and then turn into it. This is really gonna create a massage moving towards the spine here, obviously not getting on the spine, but getting at those erector systems along the side of the spine here. And oh my gosh, this is just a phenomenal technique here to get those areas loose and mobile. Now be mindful here when you're doing these exercises to not move into excessive extension in your spine. Obviously, as you arch your back, you'll probably get deeper into the muscle tissue, but you won't be putting your hips or your trunk in a great position. So those are our techniques here with the ProPoint. You'd obviously want to do the same thing on the other side, but man, I already feel more loose, more mobile on that side. It's great. You can even mess around with the position of the ProPoint along the back there as long as you're not getting directly on to the bony processes of the scapula or the spine. Thanks so much for watching, you guys. If you want to check out the ProPoint, go to optp.com.